Hey folks, Dr. Dan here. Thanks for joining me on DocTalk today. We're going to have a great show. Dr. Shane Terrell from Production Animal Consultation is going to be here to talk about different chute-side diagnostics that we can do to determine the lameness of cattle in your feedlot. Everything from infectious to traumatic injuries, we're going to have it for you today, so stay tuned.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Well, Dr. Shane, welcome to the show.
Thank you. Well, I appreciate you having me on.
You bet. Folks, Dr. Shane Terrell, he's a DVM and a PhD. Is one of the veterinarians for Production Animal Consultation, otherwise known as PAC. Great to have him on the show. Find him a time when he can get down here out of Nebraska into Kansas. And we're going to talk about the foot, basically about lamenesses and things to that nature. But your dissertation and your research, you've done a lot of work on cattle feet and different abnormalities. So can we just kind of start out by talking a little bit about the foot and some of the common things that we see?
Absolutely. And when we think about diseases of the foot or causes of lameness, we think about first infectious causes, which is probably the ones that are most common. So we have foot rot, hairy heel wart, are diseases that are problems of hygiene, muddy pens that have a bacterial component that creates an infection. Other common causes that we didn't think was as common until we started doing a little more aggressive diagnostics, looking a little more directly at some of these causes would be toe abscesses, sole abscesses, lacerations. Those are primary bruises or hemorrhages of the sole area that, if untreated initially, we can cause can lead to infections of the joint, and so we end up with our secondary infections of septic joints, which is a lot of times was misclassified as foot rot, but is actually an infection of the joint itself, in which our outcomes are quite a bit poorer.
Yeah, and didn't you say when you start to get from some of these things, if left untreated or if the animal's not cared for, can actually lead to a septic joint or wind up being that chronic?
Absolutely. So so those secondary infections or those septic joints can come from either untreated toe abscesses, sole abscesses, or foot rots primarily. But in any of those causes where we have loss of integrity of the area of the foot, so either through the skin or through the white line of the bottom of the foot, where we can introduce bacteria, any of those can eventually lead to those septic joints.
I think one thing that has been interesting from your research, which there's many things that are interesting, but we used to be of the mindset that until the calf is so lame that it can't compete with its pen mates, if it's got a little limp, we're just going to leave it. Absolutely. But your research shows the sooner we get on it, the better chance we have of it recovering. Absolutely,
absolutely. Our outcomes, no matter what the cause, outside of a catastrophic injury of some sort, no matter what the cause, timing and intervention is key. So if we can address those when they're an early hemorrhage of that toe and get those potentially drained or treated to prevent a secondary infection, or if we can treat an infectious foot rot early in the disease process prior to infecting that joint, our outcomes are significantly better.
Yeah, so that's what we're going to talk about, folks. When we come back from break, we're going to talk about some of the things that you can do by picking that foot up, making sure you get the proper diagnosis, doing it early, great intervention, better success and treatment success for your cattle. Thanks for watching DocTalk. More after these messages.
My name's Karen Cope, and I have multiple sclerosis. I heard about the stem cell research with the Kansas Regenerative Medicine Center. Before we decided to do that, I had cognitive testing done. After the stem cells, I had the cognitive testing completed again, and the results indicated that I had a 6-point increase in my cognitive abilities. It was like somebody had taken Windex and washed all the fog off my brain, and so I had the concrete, validated information that stem cells work.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment brought to you by Santa Fe Trail Meats in Overbrook. Visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Shane Terrell, who's a DVM PhD, heads up research and also is a practicing veterinarian for production animal consultation. He's located in Nebraska, and we are talking about lameness and about early diagnosis in the foot. And you have some tools here. Yep. that you're going to talk to us about for a little bit.
Absolutely. If we're looking at intervening for a lot of our causes, first we got to make sure that we have the tools in place so we can first properly diagnose those animals, and secondly properly treat those animals. So the first thing that we need to do is make sure that we provide an environment that's safe for both the animal and for the caregivers who are trying to diagnose those animals. So the first thing we need to do is either consider tilt tables for proper restraint of the animal. If we don't do that, what I utilize primarily is a rope and a pulley system to lift up those feet to make sure that we securely get those feet secure so we can properly diagnose those animals.
And I think a lot of people, and I can remember back to my dad and myself in practice, when you pick that foot up, have your wash bucket and a scrub brush, get that thing cleaned up so you can really see what you're dealing with.
Yep, absolutely, absolutely. Clean that foot up. Once we clean that foot up, then we're going to go ahead and do some further diagnosis where some of these tools come into play. So the most important thing that we can have around is a pair of hoof testers. You've probably seen farriers possibly have these around, or your veterinarians try it for equine lameness diagnosis. But it's an important tool to identify areas of sensitivity in that foot. So when we're looking at specifically toe abscesses and sole abscesses, we'll take the hoof testers, go ahead and squeeze, and it'll be a pretty firm squeeze on that toe to try and either we'll identify a pain response where that animal's going to flinch or try and move its foot based on the pain response, or else we could find a very soft empty socket where there was an abscess that's gone ahead and either moved out through the coronary band or into the joint itself. When we're testing the sole, across the sole, we're going to take the hoof testers and we're going to go ahead and squeeze across the back of the bottom of the foot and the sole about 2/3 of the way back. Those are where we're going to primarily find most of our sole abscesses. Sole abscesses was a diagnosis we didn't think was a problem of feed yard cattle or beef cattle in general. It's very common in the dairy industry, but as we've picked up feet and pushed for further diagnosis, we've found that it's not only there present, it's fairly a common lesion. It's just misdiagnosed and underdiagnosed.
And I think that's what a lot of this is about, is that we've just called everything a foot rot or a club foot and gone on about our business. And what your research and your diagnostic work has shown is that, man, we're missing the boat on a lot of these.
Absolutely, absolutely. And that's what we've called, again, foot rots commonly are septic joints that are secondary to some of these primary traumatic or concussive type of lesions,
so you're looking at toe abscesses, sole abscesses as being your two top non-infectious?
Yes, non-infectious types, some lacerations in addition. but those are the two most common non-infectious or traumatic type of causes.
Great. Well, we got to take a break here, but when we come back, we're going to talk about what we're going to do when we get that calf's foot picked up, some of the things that we're going to do on diagnosis, and some of the tools to help treat them. You're watching Doc Talk, and we're glad you joined us.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source, together we grow.
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
We are Mike and
Martha
Armitage here at the A-Bar Ranch, Claremore, Oklahoma. We have a cow-calf production company, and we also have a marketing company. We have entertained groups brought to us by the Beef Checkoff, such as South Korean media that covered our operation and brought the good news back to South Korea.
That was a really neat experience, and that we got to have young people from another country that we got to experience a lot of different things in their culture, but got to share our culture too.
We live on the Squaw Creek Ranch. Here is a division of the A-Bar Ranch.
As a wife and a mother, and also with my background in more of a health field, I look at just the nutritional value, and it's great that the Beef Checkoff offers that kind of information to the consumers that are out there.
We both are proud to come from agricultural, more specifically ranching backgrounds.
My dad is a part of the Beef Checkoff board, and so the Beef Checkoff has been something that we promote and that we support what it has to offer.
Not everybody who's in agriculture is tech savvy on Facebook and through social media. Most people in the city happen to be, and they are very disconnected from our day-to-day routines, and that's one thing that makes me proud of the Beef Checkoff, them going to bat for us. From those who aren't necessarily anti-ag, but just simply don't know and they aren't getting the information.
As producers, we're strong supporters of that, and hope that many of you out there realize all of the different things that the Beef Checkoff brings to the table for us as producers.
Sure Crop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business that started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well in their planting systems and what they're doing. Sure Crop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but yet we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, and we're glad to answer and work with you.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Shane Terrell. We're at Kansas State University, and Dr. Terrell is a veterinarian who practices with veterinary production animal consultation, and he also heads up their research as the research director. But let's talk about, let's start out with foot rot. Okay, I pick up the foot. What am I going to see with foot rot?
So foot rot, typically we're going to see symmetrical swelling. Between those two claws, we're going to see even swelling between those claws. That's going to cause those claws to go ahead and separate to some degree. When we smell that foot, we're going to have a necrotic smell. The bacteria, the name of the bacteria is Fusobacterium necrophorum, which in itself says that necrotic or really foul smell. So we'll have those. Those will be the most diagnostic. So if we see that animal with the symmetrical swelling at the chute, we don't need to necessarily lift that foot unless we see swelling above that up into the joint itself. And so that's the one instance where we can go ahead and leave that foot down, just treat it for foot rot and move on. So.
Okay. And then the other one that has not been as common until recent years is the hairy heel wart.
Yeah, and again, probably underdiagnosed and misdiagnosed as foot rot previously, but hairy heel wart's going to be a bright red lesion. Typically there's different stages, M1 through M4 stages of that, but in general it's a very painful lesion on the back part, between the claws on the back side of the heel area. It's going to be bright red in some instances. In other instances it's just going to be kind of a area that's pared out and kind of we see some ulcerations in that spot. So when we see that, we'll press the back part of the heel. We'll see it have a very profound pain response when we press in that area. Parenteral antibiotics haven't been very successful in those cases, and so our treatments are going to be more topical treatments for that diagnosis.
And so you'll use foot baths and different things of that nature.
Yeah.
And
foot baths and wraps are all means of treatment.
You bet. Well, I think that understanding these two infectious agents, hairy heel wart's pretty contagious, right?
That's somewhat debatable. We set up those conditions in a pen. It's hard to produce that disease experimentally, and so we don't really know how contagious it is, or if we just in that pen we've set up the conditions for an outbreak itself. That bacteria is present in the GI tract and in these animals, and so whether it's highly infectious or not, if we set up the conditions, the environment for that to thrive, it can pop up in a big way.
You know, pen conditions, you made mention of that, are pretty important in controlling a lot of these diseases. What are some of the more common issues in pens that you see?
So in general, mud is one, but any time where we produce a condition where those animals never have the ability for that skin to dry out, so water pooling around water tanks, if we don't have proper drainage around water tanks, you know, we can control mud as best as we can. In some periods of the year, in some environments, it's tougher to do than others. But in general, creating an opportunity for that heel area region to dry out is necessary.
I think some of the times, you know, when you get that skin on the hooves that's real soft, and you have the areas that could cut, you know, the dry areas in the pen, wet and dry areas together. It seems like if the pen's totally wet or totally dry, we get along a lot better.
Absolutely.
All right, folks, we're going to take a break. When we come back, we're going to get into some hoof pairing here, and we're going to talk about those toe abscesses and sole abscesses. You're watching DocTalk. Thank you.
We do business with Blueville because of the quality of their work. It is excellent quality, and because they make a commitment to their customers.
We enjoy the benefits of hiring a good company to help us maintain this home.
We will always do business with Blueville. We have for many, many years, and there's no reason for us to look for any other service.
Hi, I'm Randy.
And I'm Paul from PFI.
We would like to personally invite you to stop by PFI, home of Boot Daddies.
PFI is America's Western store, covering over 50,000 square feet.
Over 25,000 boots.
Visit Saddle City with the largest selection of saddles and tack anywhere.
A huge selection of hats at Big Spur Hat Company in PFI Town.
And choose from the best brands of clothing and accessories for the entire family.
PFI, located on Highway 65 at the Battlefield exit in Springfield. And I'm not kidding.
Hey folks, thanks for joining me on today's Cattle First Minute as sponsored by Beringer Ingelheim Vet Medica. Today, we're going to talk about colostrum. Colostrum is the first immunity that a calf receives in its life. Within the first 6 to 12 hours of life, we want that calf to get up and suckle the first milk from the mother. That first milk is what we call colostrum, which is packed with antibodies, which then help protect that calf from viruses and bacteria such as E. coli and scours, in which the calf will be exposed to on the farm. The cow is a great source of antibody because she's been living in that environment, been vaccinated for different diseases. She produces those antibodies in the colostrum. We want the calves to be able to get it in the first 6 to 12 hours. So wait to tag that calf until after that calf has had a chance to get colostrum, because it's vitally important for the calf's health
and it's the first step towards raising a healthy calf.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook or Twitter.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Shane Terrell. He's with Production Animal Consultation, where he's a veterinarian and also has his PhD in production animal medicine, working on lameness. And so talk to me a little bit, we hadn't got to the nippers and the knives, about what we're going to do with these toe abscesses.
Yep. So when we move into the more traumatic causes, toe abscesses, sole abscesses, you certainly consult your veterinarian on proper treatment of these or their recommendations. But in general, we need to allow for the undermined sole to be removed, and so if there's pus forming in those places, we need to get that pus drained and remove the sole that is present over top of those.
So when toe abscesses are aggressive or wilder cattle,
yep.
aggressive cattle, poor cattle handling, rough surfaces,
yep.
will lead to all these, right?
Yep, absolutely, absolutely. So a lot of these lesions, specifically toe abscesses, will be we'll see early in the feeding period in the feedlot, either whether they happened in the transport phase or the sale barn phase or through processing at the feed yard, but we'll typically see those in the first 3 or 4 weeks of cattle on feed. And
one of the things that you said when I heard you speak was that if you don't treat them, that abscess is going to go somewhere.
Yep.
And where are the 3 places it can go?
In general, it can either move up into the joint and,
yep.
and set up in the joint, and that's when we get septic joints. The second opportunity is for it to come up the hoof capsule and come out the coronary band, and so it'll come to that hoof to skin junction somewhere, and if it does, that'll lead opportunities for other secondary pathogens to come in and cause an infection. Or the third place is to go out the bottom of the foot in the white line area. Very few of them we see do that. Most of them move up somewhere, but if we don't do something with these, a lot of times will lead to septic joint.
And I heard you say one time that you have a calf that's lame and the next day it's not lame. Sometimes those things will bust and they'll feel a little bit better, but then they just go down.
It doesn't mean our outcomes are better. Yeah,
right.
Exactly.
So tell me a little bit about what we're going to use and what we're going to do.
So I use a hoof nipper. We can have 10-inch to 14-inch hoof nippers in a chute. When I lift up the feet, I like the smaller ones myself, but what our goal is to provide an opportunity for those toes to drain, those toe abscesses to drain. What I'll do is I'll make I'll nip that toe perpendicular to the ground to provide opportunity for that pus to drain forward, not down. So we don't want to cause a hole on the bottom of the foot, so we get more dirt and mud into that area. So, and every time that foot steps down, it's going to work like a piston and push that pus out of there. So it's going to work to our advantage there. So that's going to be important for the toe abscesses. When we move into the sole abscesses, what we'll want to do is find that, and what we're going to do is actually pare any undermined sole out, kind of like an apple, like a bad spot in an apple, and we'll just keep taking that sole out until we get to the junction of true tissue from the sole, and just remove all that undermined sole where we've had pus in before, and that'll allow a new horn to grow in over top of it and provide a place for that to drain. And if you were going to use these, make sure we have the proper sharpening equipment. This is a rubber wheel and a felt wheel. If we have dull knives, we aren't going to get anything accomplished. So make sure we invest in the $70, $80 investment to make sure these knives are effective.
Well, thanks a million for all you're doing, and thanks for bringing this awareness to our industry. Really appreciate it.
Oh, thank you.
Great work. Folks, thanks for watching Doc Talk. Remember, always work with your local veterinarian, and if you want to know more about what we do here on the show, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson here with Dr. Shane Terrell. Thanks for watching Doc Talk, and I'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.